Hey everyone, welcome back to all my listeners. This is episode number 2 of season 10. Today is Wednesday, September 13th, 2023. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, let's get right into it today. It's the second Wednesday of the month, so you know what that means. I'll be unpacking the OIG's August 2023 work plan updates in today's Newsworthy. And there are 5 work plan updates. And in my compliance tips and in my compliance recommendations today in Trusty Tip, I'm going to be getting into the finally released, I've been waiting for a month or two, on that 8th CBR for the year. That's right, and it's going to be on laboratory tests for blood counts. And I go ahead and round out today's episode in Spark with a remarkable quote on success by Winston Churchill. If you guys have checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and our valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve your coding accuracy as you help all your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts, and definitely start following and loving this podcast on Spotify or wherever you listen to my podcast. Amazon Music, maybe, on my YouTube channel, wherever. I'd really love your continued support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my compliance recommendations based on my over 13 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So, let's get into Newsworthy, the month of August's OIG Work Plan updates. Now, there are 5 updates to the OIG Work Plan for the month of August 2023. The first update is titled, Maintaining Buprenorphine Treatment for Medicare Enrollees with Opioid Use Disorder. Now, this report is expected from the Office of Evaluation and Inspections. Opioid-related overdose deaths in the United States remain quite high at an estimated 82,310 individuals in 2021. Now, ensuring that individuals who start treatment for opioid use disorder stay in treatment for as long as necessary is critical to addressing the opioid crisis. Yet little is known about the extent to which people enrolled in Medicare Part D maintain their buprenorphine treatment, which is the most common medication for the treatment of opioid use disorder in Medicare Part D. Research has shown that discontinuing treatment medication such as buprenorphine increases the likelihood of overdose deaths. Moreover, longer retention in treatment is also associated with improved outcomes, such as decreased rates of emergency department visits. This study will look at the extent to which people enrolled in Medicare Part D maintain buprenorphine treatment for at least 6 months. It will also look at the extent to which these enrollees, including the setting in which they start their treatment and the services they receive, differ from enrollees who do not maintain treatment. Now, this final report is expected in fiscal year 2024. Now, the second OIG Work Plan update for August 2023 is titled Toolkit, Insights from OIG's Work on the Office of Refugee Resettlement's Efforts to Care for Unaccompanied Children. Now, this report is expected from the Office of Evaluation and Inspections. The Office of Refugee Resettlement, or the ORR, is a program office of the Administration for Children and Families, and it has custody of and must provide care for children in the Unaccompanied Children Program, or the UC program. The number of unaccompanied children referred to ORR by the Department of Homeland Security has fluctuated over time, with large numbers of children in ORR custody during surges. OIG has published works that encompasses many aspects of the challenges faced by ORR in managing the UC program. Since releasing its first ORR toolkit in 2021, the OIG has conducted new audits and evaluations that cover topics such as placements and transfers of children in the UC program, emergency intake site operations, and safeguarding against the spread of infectious diseases, including COVID-19. This updated toolkit will provide an up-to-date resource on ORR's administration and oversight of the UC program by integrating new insights from OIG's recent work with insights from the first toolkit OIG published back in 2021. This final report is expected in fiscal year 2023. Now, the third OIG Work Plan update for August 2023 is titled Audit of the Administration for Children and Families Transitional Living Program. Now, this report is expected from the Office of Audit Services. HHS's Administration for Children and Families, the ACF, provides funds to public and nonprofit organizations for administering the Transitional Living Program, the TLP. Now, the TLP supports the delivery of various services to youths aged 16 through 21 who are experiencing homelessness. The services consist of three things. Number one, they will be providing shelter, for example, in group homes, in maternity group homes, in hosting family homes, and in supervised apartments. The services will also consist of number two, a service coordination plan that refers youths experiencing homelessness to social services or law enforcement or educational services, vocational training, child welfare, legal services, affordable child care, or child education programs. And finally, third, that third service is going to consist of a transitional living plan that provides basic life skills, money management, job attainment skills, counseling, mental and physical health care, other youth development services, and aftercare resources to support the transition from supervised participation to independent living. In fiscal year 2022, ACF provided more than $53 million to fund 225 TLP awards to 175 grant recipients across the United States. OIG will determine whether selected TLP grant recipients provided services to those youths experiencing homelessness according to federal requirements. This final report is expected in fiscal year 2024. Now, the fourth OIG Work Plan update for August 2023 is titled Audit of Health Centers' Use of COVID-19 Supplemental Grant Funding and Reimbursement from the HRSA COVID-19 Uninsured Program. Now, this report is expected from the Office of Audit Services. The Health Resources and Services Administration, or HRSA, awarded supplemental grant funding totaling approximately $8.1 billion to 1,387 health centers nationwide in fiscal years 2020 through 2022 to respond to the COVID-19 public health emergency. The funding was intended to support the health centers' activities related to the detection, prevention, diagnosis, and treatment of COVID-19, including expanding COVID-19 testing and administering COVID-19 vaccines. Separately, during the same period, the HRSA Uninsured Program, the UIP program, reimbursed providers more than $24.5 billion for conducting COVID-19 diagnostic testing and providing testing-related items and services to uninsured individuals. The UIP terms and conditions stated that recipients should consider payments from the UIP to be payment in full for COVID-19 testing and or testing-related items, vaccine administration, care, or treatment. According to HRSA, health centers should have accepted any UIP payments as payment in full and should not have charged any of the same costs to their COVID-19 supplemental grant funding, including the difference between the amount claimed to the UIP and the amount they were reimbursed by the UIP. Prior OIG work identified that some health centers charged costs for processing COVID-19 tests to their COVID-19 supplemental grant funding and also submitted claims and received reimbursement for the same services from the UIP. So OIG will determine if health centers that submitted claims for COVID-19 testing and received reimbursement from the UIP also received reimbursement from grant funding for the same costs. This final report is expected in fiscal year 2024. And the fifth and final OIG Work Plan update for August 2023 is titled Medicare Part B Payments for Over-the-Counter COVID-19 Tests During the PHE Demonstration. Now, this report is coming from the Office of Audit Services. On April 4th, 2022, CMS launched the Medicare Over-the-Counter COVID-19 Test, or OTC test, demonstration to cover and pay for OTC tests for people with Medicare Part B benefits, including people enrolled in Medicare Advantage plans, for the remainder of the COVID-19 public health emergency. During the period, Medicare covered for each enrollee up to 8 OTC tests per calendar month. If an enrollee received more than 8 OTC tests in a calendar month, the enrollee may have had to pay out-of-pocket costs for the extra tests unless the enrollee had additional health coverage. The OIG will determine whether Medicare paid eligible pharmacies and healthcare providers for OTC tests according to the demonstration period. And now, it's time for my best practice tips in Trusty Tip. So in today's compliance tip, I wanted to unpack the comparative billing report on laboratory tests for blood counts. Now this is CBR number 202308. That is right, it's the 8th CBR for the year for 2023. Now CMS will be issuing a comparative billing report right now as I'm recording this episode to rendering providers that submitted claims to Medicare Part B for laboratory tests for blood counts. Now, this analysis will focus on Medicare Part B claims submitted with our current procedural terminology codes. Those are our CPT codes 85025 and 85027. Now, the CBR analysis was based on claims extracted from the Integrated Data Repository based on the latest version of claims available on July 14th, 2023. Now, the analysis includes paid claims with dates of service from April 1st, 2022 through March 31st of 2023. The 2022 Medicare Fee-for-Service Supplemental Improper Payment Data Report reflects a projected improper payment rate of 11.3% for lab tests for blood counts, which represents over $19 million in projected improper payments. Now, after reviewing and researching the improper payment rate, this CBR was created to analyze the possible threat to the Medicare Trust Fund associated with laboratory tests for blood counts. Now, the expectation is that rendering providers of laboratory tests for blood counts will maintain proper coding documentation and confirm the appropriate use of CPT codes. Now, the criteria for receiving this CBR are that a provider was, number one, found to be significantly higher compared to either specialty or national percentages in either of the two metric calculations, which means they were found to be greater than or equal to the 90th percentile. Now, they should have had at least 130 beneficiaries with claims for laboratory tests for blood counts. And finally, they will have had at least $1,400 in total allowed charges. So let's get right into those CPT codes in the spotlight here, right? So CPT code 85025 is defined as blood count, complete CBC, automated for your HGB, your HCT, your RBC, your WBC, and platelet count, and automated differential WBC count. Now, the second CPT code is CPT code 85027, which is defined as blood count, complete CBC, automated HGB, HCT, RBC, WBC, and platelet count. Now, the metrics that are involved for this particular CBR. Now, there are two metrics. Number one, that percentage of Medicare Part B claim lines that are for laboratory tests for blood counts. And number two, The second metric is for that percentage of laboratory tests for blood counts per CPT code. So the CBR analysis 202308 focuses on those rendering providers that submitted claims for laboratory tests for blood counts using those two CPT codes, 85025 and 85027. So statistics were calculated for each provider, all providers in the specialty, and all providers in the nation. Now, the specialty and national peer groups are defined like this. The specialty peer group is defined as all of those rendering providers that are practicing in the individual provider specialty group, with allowed charges for the procedure codes included in this study. So those providers were divided into 3 specialty groups based on providers designated primary specialty, which is found within the provider enrollment chain and ownership system, the PACOS system. So number 1, providers with family practice, or providers with internal medicine, or providers with nurse practitioner, or providers with physician assistant, which was labeled as their primary specialty, and that's defined with the primary care specialty label. Also, number 2, those providers that are designated and labeled as hematology and oncology as their primary specialty. So their specialty label, again, is for hematology oncology. And then finally, 3rd, providers that were also included are those vascular surgeons in the primary specialty, which is called vascular surgery. So their specialty label is vascular surgery. So the national peer group is defined as all of the rendering Medicare providers in the nation with allowed charges for the procedure codes included in this study. So it was found that there are 43,628 rendering providers nationwide that have submitted Medicare Part B claims for laboratory tests for blood counts. Now, the total allowed charges for these claims were over $57 million during the analysis timeframe. So remember that the laboratory tests for blood counts vulnerability exists, right? Which is why you're receiving this CBR. And be mindful that according to that 2022 Medicare Fee-for-Service Supplemental Improper Payment Data Report, the improper payment rate of 11.3% was found for lab tests for blood counts, which represents, again, a whopping $19 million plus in projected improper payments. So the CBR, once again, just as in the 3 previous CBRs that I highlighted on my podcast for the year, provides absolutely no details on the percent of incorrect coding or the percent of insufficient documentation or the percent in the lack of medical necessity. Nothing. There are no details provided in this CBR. But do be mindful that the desired behavior for laboratory tests for blood count services, right, is absolutely 100% to protect the Medicare Trust Fund. Also, to increase our providers' awareness about potential improper payments for these types of services, these laboratory tests for blood counts. Also, we are supporting our providers' internal compliance processes by issuing the CBR, right? It's also a very good tool to address your internal compliance processes. And of course, the CBR encourages self-audits for compliance. Now, it's critical to understand that a CBR does not indicate that you're going to get an official audit, although I've said this on every single CBR episode I've released over these past few years, and definitely for 2023, right? Be mindful that this phrase does come directly from the MACs that issued the CBRs, so definitely take that with plenty of grains of salt. More directly consider this to be your notice, your warning that you are being looked at closely. Now, the value of the CBR to providers is that it serves as a tool, like I've said time and time again, to look at your billing patterns as compared to your peers in your state as well as across the nation. Now, the value also includes the facts that specific coding guidelines and billing information will be detailed, as I highlighted already. Now, the CBR informs providers whose billing patterns differ from those of their peers. Now, my best practice recommendations always include review the HCPCS codes and the CPT codes that are addressed in your CBR to ensure that the correct code assignment is performed. You should also be internally performing regular reviews of your documentation and code selection to ensure accuracy and compliance, because I know for a fact that these 2 steps alone can help reduce the possibility of improper payments. And remember, we have no details on how much is exactly attributed to insufficient documentation, and we have absolutely zero information on if any of this is due to incorrect coding. So this CBR should have all of us providing laboratory tests for blood count services really buckle down and self-audit, whether we received this CBR in the mail or not. It's a great time to dive deeper into your own data, help yourself, and definitely help the Medicare Trust Fund at the same time. You should be paying attention to what you're sending out the door. Is it really in compliance? So stay ahead of the curve and avoid receiving post-payment audits from the payers down the road. It's fundamental, if you have Medicare as a payer, to keep your eye on correct and compliant coding and compliant billing practices and make sure that you're adhering to all of them. A better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, I focus Season 10 Spark on perseverance. I want this 10th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for perseverance in all we strive to do. So, in this week's inspiring quote in Spark is from Winston Churchill. Success is not final. Failure is not fatal. It is the courage to continue that counts. Absolutely true, right? I think this is an incredible quote that keeps us bold. This quote inspires us to pick ourselves up after we stumble and fall. This quote reminds us that we are our own best champions. Believe in yourself and you will keep going. With gumption and grit, everyone can find what it is they're looking for. I'm happy Winston Churchill's spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. So in my final note today, I hope you guys are enjoying the cooler nights like I am. A few trees are already starting to pop their colors. I'm very excited to be heading to Hudson Valley, New York next week for the Advanced Coding Services Retreat, where I'm going to be speaking in person for this amazing educational organization that sponsored this podcast in Season 9. Now, anyways, you guys, remember to celebrate life each and every day. Reach out a hand if you know someone in crisis, because I do believe that kindness and really listening go much farther than you can imagine. Make sure that you're carving out timeouts for yourself as well to stay sane and steady. All right, you guys, I wish you guys a very amazing and happy week ahead. Thank you guys so much for listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.